Welcome back. Now, the Ministry of Health has intensified efforts to eradicate tuberculosis in the country with the aim of achieving 0 deaths from TB by 2030. The ministry, through the National TB Program in collaboration with partners and county governments, are engaging in active TB case findings within communities so as to improve the number of patients accessing treatment. And as Emily Chebet reports, the latest report by the ministry shows that Nyamira North Sub-county is leading in the quality of care of TB patients in the country.
With the onset of COVID-19 in 2020, a significant number of TB patients were missing. Majority of the cases were undetected, untreated, and unreported. Reason being, both healthcare workers and the patients themselves could not distinguish between the symptoms of the deadly virus from those of tuberculosis. Mary Kerubo, a resident of Ekerenyo village in Nyamira Sub-county, cheated death by a whisker after being quarantined in 2020 because of COVID-19-like symptoms such as coughing. But as it turned out, it was not coronavirus.
Nilianza kukoa, nikaenda hapo clinic, nikapewa madawa. Nilipewa hiyo madawa ndio niliungua sana. Nilikuwa na jasho sana. Wakanipeleka quarantine, nikakaa wiki mbili.
In 2020, the World Health Organization revealed that COVID-19 had reversed years of global progress in tackling TB, and for the first time in over a decade, deaths had increased. Kenya is one of the 30 countries with a majority of at least 83% of cases, with an estimated 140 people said to have TB. But what can end this disruption? Healthcare workers are part of the key population that the government is keen on training given the pre-exposure within the facility. Jeremiah Areba, a healthcare worker in Ekerenyo Hospital in Nyamira Sub-county, like Kerubo, was not sure about the symptoms.
11th February 2021, when I did an MRI, that was the time I was diagnosed that I'm suffering from TB of the spine.
Kubiwa X-ray wakapata niko na kidonda kwa kifua.
The partnership between the counties and the Center for Health Solution through Tuberculosis Accelerated Response and Care 2 have intensified the identification of TB patients within the community.
We support clinical reviews whereby we sit down with the respective healthcare workers and managers to discuss how patients are doing for better continuum of care and better outcomes.
Through the supportive supervision that we conduct, we've been able to improve on knowledge and skills gaps that we had.
TB remains a global and national public health concern. Globally, 140 million people are infected with TB, of which nearly 1.5 million die each year. But early diagnosis and proper treatment will reduce TB-related deaths.
If we follow according to prescription and the dosage you are given, you are there and comply with the medication well, you are able to conquer TB.
Madaktari wa Ekerenyo walinikarisa chini, wakaniongeresha, wakaniambia TB ui. Nilikunywa hiyo madawa.
The 2021 National Performance TB Scorecard by the Ministry of Health National TB Program ranked this small sub-county of Nyamira North top. Their success attributed to the tracing and follow-up on TB patients to ensure treatment adherence.
This has also done well, and it has been able to at least increase the TB cases and find the 40 missing cases that the TB program is looking for.
We were posting cure rates of below 90, that is around 80, 85. But in like 2021, we posted a cure rate of 95%, which is a good improvement.
TB remains an endemic. Kenya is part of the global target of ending TB by 2035. Emily Chebet, Citizen TV, Nairobi.